Hello Brain Shakers, welcome to the Brain Shakers Academy. Your host here, Brave Alistair, is excited for today's session where we're going to be looking at a female sterilization. Now, what is female sterilization? Female sterilization basically is a type or a form of contraception method that is a permanent form of contraception. Now, we're saying permanent because the intention of female sterilization is to give you permanent contraception, but then there are developments where we can obviously potentially do a reversal of that type of contraception. But for now, and in this particular session, we will take it is a permanent contraception, not until I look at the reversal of sterilization methods in yet another video. So if you are not yet subscribed to the YouTube channel, what are you waiting for? Go ahead and subscribe to the YouTube channel and follow me on all the various platforms. Now, let's quickly dive into today's session and look at female sterilization. What are the various types of female sterilization? So when you're talking about female sterilization, of course, I have drawn a simplified diagram here to look at the uterus, the fallopian tubes, and the ovaries. And this is going to basically be our basis for understanding female sterilization. But there are a number of methods that we can talk about when we're looking at a female sterilization. And these types of female sterilization, they have various indications for them to obviously be performed. So you have, number one, a procedure that you can call oophorectomy. This is basically just the removal of the ovaries. And then you have fimbriectomy. So fimbriectomy, the part of the fallopian tube where it has these finger-like projections. So once we excise this and remove this portion, then we would have gone with fimbriectomy. Now, in most cases, when they get to this extent of doing fimbriectomy, they may as well remove the entire fallopian tube or a portion of the fallopian tube. And that brings us to a third type, which we will call salpingectomy. Now, the fallopian tubes are also referred to as the salpings. So once we have removed a portion of the fallopian tubes, we're going to term that as a partial salpingectomy. And if we remove the entire, then it will be a complete or a total salpingectomy. And so when we have removed this fallopian tube, we may as well remove the fimbriae. So meaning that we are going to do together the salpingectomy and the fimbriectomy together. Now, there are certain times when we're going to remove the entire fallopian tube and remove the ovaries as well, and that is going to be referred to as salpingo-oophorectomy, meaning that we are removing the fallopian tube as well as the ovary. So that is another type. So we can call this salpingo-oophorectomy. Okay, so in other cases, when indicated, we can go ahead and remove the entire uterus. Now, the removal of the entire uterus is a procedure known as a hysterectomy. Okay, that is going to be a hysterectomy. So all these methods that we have made mention here are going to offer a female sterilization, meaning that now the chances of this woman undergoing menstruation or undergoing fertilization of that ovum now become limited, and this is a permanent form of contraception. Now, I'm saying permanent for the basis of this discussion, and in a later video I'm going to look at possible chances of us doing a reversal to this. But the mere intention of doing this for contraceptive basis is to offer prolonged or rather permanent sterilization as a contraceptive method. Now, if we have not done any of these, in most cases we will be doing what is referred to as a bilateral tubal ligation or a bilateral tubal occlusion. So this is going to be our 6th method here. So we have bilateral tubal, which can either be a ligation here or it can be an occlusion. So this is going to depend on what we are going to use to actually close the fallopian tubes here. So this BTL or occlusion is what we are going to discuss now as a form of permanent contraception or female sterilization, because that is the most common procedure that is done. These others may be indicated when, for instance, you have problems with the ovaries, or you have some form of carcinoma that is there, and then the prognosis is poor. If you are using other alternatives, then it means that it may be indicated that then you go ahead and remove the entire uterus, or in cases when you have bleeding that cannot be controlled, and then you go ahead and do a total or a partial hysterectomy. Now, if you would like me to do any of these other methods of female sterilization into detail, drop me that comment in the comment section. For now, let us look at bilateral tubal ligation, also referred to as a bilateral tubal occlusion. Now, when we are looking at a BTL or a bilateral tubal ligation or a bilateral tubal occlusion, there are methods or approaches that are obviously used. Now, what are these approaches that we can take? So the approaches that we're looking at basically are ways in which we can gain access to the fallopian tubes themselves. So approach number one is what we can call the transcervical, meaning that we gain access through the cervix to get through to the fallopian tubes. That is transcervical, through the cervix going to the fallopian tubes. And then you have a second one, which is going to be laparoscopy. So this is going to be abdominally. So we're going through the abdomen to gain access to the fallopian tubes. And once we have located the fallopian tubes, then we can go ahead and perform that ligation or occlusion. And then we have the third method here, so the transcervical here can also call hysteroscopy. We can also call it a hysteroscopic approach. Then you have the laparoscopic approach here, and if it is not the laparoscopic approach, then we can also do a mini laparotomy. So I'll just write laparotomy. So this also is abdominal, where we make an incision in the abdomen, then again through access through to the fallopian tubes. And then number 4 here, you can also have another approach that we are going to just brand as CS, that is using the cesarean section method, meaning that when we are performing a cesarean section, and if this woman has been cancelled and has consented to having female sterilization, it may at the same time, after doing the cesarean section, then locate the bilateral tubes and then go ahead and ligate them or occlude them. So those are the approaches in which we're going to gain access to the fallopian tubes. Now, after looking at all these approaches, what are some of those methods that we can obviously look at that we're going to use to basically come about the occlusion of those tubes? So I have drawn there, which is just one side of the uterus. So you have the fallopian tube on this end, you have another fallopian tube on this other side, and that's why it is called bilateral, meaning that you have one on this end, you have another one on this end. Now, there are methods that we can use to occlude those tubes. So when we're looking at methods, number one method, we can look at the ligation method. Okay, which is the ligation method. Now, to ligate is basically to apply a band, to apply a ring, or to apply a clip onto the fallopian tubes there. It may be a suture that we're actually applying and tying that fallopian tube. So using all the various approaches that we have obviously looked at, and once we have identified the fallopian tubes, then we'll go ahead and ligate the fallopian tubes. Now, there are two common methods here that we can utilize that we would call the Pomeroy method. And you also have another method that we call the Parkland, or you can also call it the Pritchard method. So the Pritchard and Parkland's method is just a modified way of the femoral. So what is basically happening is that once you have identified the fallopian tube here with the femoral, all you would do is, if you have your fallopian tube there, you have hooked the fallopian tube, you have located it, then you hook the fallopian tube, then you go ahead and apply a suture there, or a ring or a band to actually ligate the fallopian tubes, and then you make a cut on those fallopian tubes. So it is also indicated that you may even make an incision or cut a portion of that fallopian tube that is roughly about a centimeter or so, meaning that now this is going to allow these fallopian tubes to actually be apart. So it means that from where you have ligated, this whole portion of the fallopian tube has actually going into a process to be denatured. So this whole process now is going to actually be denatured, and that will then start offering form of contraception. So you basically hook it like that, and once you've hooked it, then you go ahead and ligate. Now with the Parklands or the Pritchards, which is just a modified Pomeroy's method, you're going to have the fallopian tubes there. Let me use something that is very visible. You're going to have a fallopian tubes there, and so you ligate it on this end and ligate the fallopian tube on this end, and then cut a small portion in between here, which can be about a centimeter or so, and then this is going to make sure that these fallopian tubes now have a distance in between, and then that also disconnects them from the continuation to the ovary. So that is how you can go ahead and do that ligation and cut those fallopian tubes. Now there is also an adjunct that you can obviously use, which is basically just having this fallopian tube that you have cut on this end, fold it over to this other end, and you may also end up using another method which we are looking at as our second method, which we are going to call electrosurgery. So our second method here is going to be electrosurgery. Now electrosurgery is just basically the use of electricity, and this is also referred to as cauterization. Now cauterization, you're merely burning that fallopian tube. It means that once you have located the fallopian tube, you locate an area obviously where you're going to be applying that cauterization, and the area that is going to be cauterized is also going to be denatured. And sometimes you may ligate it, and once you have ligated this, and then you go ahead and cauterize the areas where you have done that cut. So there may be a combination of the electrosurgery together with the ligation methods in order for you to achieve a successful female sterilization. Now you can also have a third method. Now the third method is what we refer to as the mechanical methods. Okay, so the mechanical methods. Now the mechanical methods, this is where you're going to be using things like rings, you're going to be using things like clips, or you're going to be using insets or micro insets. Now micro insets, the commonest micro insets that you can have is what we refer to as an Ashua. Basically all you do is using the transcervical, so you have the commonest one is the Ashua here that you're going to use, usually made out of nickel or stainless steel. All you do is gaining access through the hysteroscopic approach, then you insert a hysteroscope, and then you will be able to insert this micro inset, or it is going to be placed is just going to be around the corners here, meaning that on both ends you insert one on this side and one on this end. And once you have inserted these, all they are going to do is they are going to initiate a tissue response, and that tissue response then is going to generate some fibrous tissue around that micro inset that you have actually placed into the corners or the starting point or openings to the fallopian tubes, and then eventually cause occlusion of that fallopian tube. Now this is not going to happen just when you have inserted it, and it will require you to have about 3 months or so for it to then be able to be termed as having offered female sterilization. And this is only going to be confirmed when you do an X-ray, you do an ultrasonography, or you can do an HSG. So HSG is just basically hysterosalpingogram, where you're looking at the uterus and the salpinx as well to understand if this has actually been occluded. So if it has not yet been occluded, or during the time when you're waiting for these tests to be run, or about 3 months, then additional contraception method will then be something that is going to be recommended, because pregnancy can still occur if the occlusion here has not yet happened. So those are the various methods that you can utilize or think about when you're thinking about female sterilization. All in all, this is a permanent method, meaning that if you are satisfied that you are no longer having any more kids, or you no longer want to get pregnant, then these are some of the approaches that can be used to go ahead and give you that contraception method as a permanent way. In most cases, it is going to be a bilateral tubal ligation, which can be performed obviously under local and general anesthesia as well. Now, if you found this particular video helpful in understanding some of the methods and approaches that are used in female sterilization, don't wait. Go ahead and subscribe to the YouTube channel, follow, hit that subscribe button so you don't miss any of the amazing pattern. I will be doing another session on some of the advice that follows the bilateral tubal ligation. So thank you so much for watching, and from me, I will see you in the next one.